trained healthcare provider, certified in ACLS and BLS. You are waiting at the curb to cross the street while car traffic is flowing. A motorcycle suddenly crashed into a vehicle, and the rider was thrown from the vehicle. He hit his head on the sidewalk in front of you. The rider has his helmet on. He lies limp on the curb. What is your first course of action?
A, B, C, D.
Correct answer, D. Ensure scene safety. You are witness to a vehicular accident. With fast-moving vehicles, it is imperative to make sure that there is no chain reaction of vehicle collision before you offer help. You observe the traffic and the surrounding scene. It seems that the vehicles are stopped around the scene and assess the environment as safe. What is your next course of action?
A, B, C, D. Correct answer,
A. Check for a response. You should determine if the patient is unresponsive. This will help you determine the next steps. The patient is unresponsive. What is your next course of action?
A, B, C, D. Correct answer,
B. Shout for help and call 911. An emergency medical dispatch is essential to send an emergency medical service team to the scene. An unresponsive person involved in a vehicular accident is serious. The patient must be transported to the hospital for expert care. A bystander is on the phone calling 911. The security guard from a nearby building approaches the scene with an automated external defibrillator. What is your next action?
A, B, C, D. Correct answer,
C. Check for breathing and check for a pulse. The patient is unresponsive, and it is imperative to determine if he has a pulse and breathing. The impact of the crash can cause cardiac arrest. High impact injuries can cause tension pneumothorax or cardiac tamponade. Remember that these are reversible causes of cardiac arrest. You determine that he has no pulse and is not spontaneously breathing. You begin CPR while the security guard has connected the AED to the patient, and the device has been charged and prompts you to deliver the shock. What will you do next?
A, B, C, D. Correct answer,
D. AHA ECC guidelines suggest that for witnessed adult cardiac arrest once the AED is immediately available, the defibrillator must be used as soon as possible. Chest compression interruption can be considered at this time because it is an intended part of required care. In this case, you have witnessed the arrest, and the patient was immediately connected to an AED that prompted the rescuer to deliver a shock. You deliver the shock. What is your next action?
A, B, C, D. Correct answer.
D. Immediately continue high-quality CPR with 2 rescue breaths every 30 compressions. There must be no delay in providing high-quality CPR. AHA ECC guidelines also recommend to immediately perform CPR rather than checking for pulse right after defibrillation. Always keep in mind to minimize interruptions in chest compressions. Interruptions can be considered if it is part of a required care, such as defibrillation, analyzing rhythm, checking ventilation, applying an advanced airway, or giving 2 rescue breaths. Less than 10 seconds of interruption. The following procedures correspond to delivering good rescue breaths.
A, B, C, D, correct answer.
D. All of the responses are correct. You and the security guard have provided 2 minutes of high-quality CPR, delivering 2 rescue breaths every 30 compressions. What is your next course of action?
A, B, C, D, correct answer.
A. Rotate with the security guard and continue high-quality CPR for 2 minutes. Studies have shown that when a rescuer performs CPR, rescuer fatigue occurs. When fatigue sets in, high-quality CPR is compromised. The AED automatically checks for rhythm. It will determine if another shock is required. While the security guard is performing CPR, the AED prompts you to stop CPR for a rhythm check. You follow its instructions and you check for the pulse. You feel a pulse. You then notice that the victim is breathing normally and moves spontaneously. He is still unarousable and does not follow commands. Paramedics arrive and transport the man to the emergency department.